Hi friends, American Heart Association giving chance to download ebook from Play Store. ACLS, it means Advanced Cardiovascular Life Support. It is a systematic manner and all algorithm we can see in this book. How we can approach the patient systematic? First, we want to look at initial impression. What do you mean by initial impression? Visually check while approaching the patient. So we can identify if the patient is conscious or unconscious. It means A. How is the appearance? Is the patient is conscious, oriented, lethargic, drowsy? Then next we can see breathing. How is the breathing? Is it labored breathing or crepitation or wheezing, anything? Then how is the skin color? Is the pulse cyanotic? If anyone is not good, you can call for help. Second one is primary assessment. In primary assessment, first airway, second breathing and circulation. In airway, we want to check if there is any resistance, any secretion, airway is maintained, airway is pattern. And in breathing, we want to check what is the respiratory rate, how is the respiratory effort, air entry, any added sound is there, how much the saturation. Then we will move to circulation. In circulation, we will see central and peripheral pulse is palpable. What is the pulse rate? What is the blood pressure? How is the skin color? What is the skin temperature? Then blood work, cannula. Then ECG, 12 lead ECG. Everything we can include. Next, we are going to disability. AVPU. A means is the patient is alert, is the patient responding to voice, is the patient responding to painful stimuli, a patient is unconscious or conscious. Then we can add what is the pupil size and reaction, what is the blood sugar. Last one is exposure. Exposure means we want to check, assess the patient if patient have any trauma, burn, chest pain, neck vein distension, organomegaly and pedal edema, systemic perfusion. Let's move to secondary assessment. In secondary assessment, we want to remember sample. Sample means S means signs and symptom, A means allergy, M means medication, P past medical history, L last meal, liquids consumed, then E events. If we will explain signs and symptoms, we can ask the family member what signs did you see before arriving to the hospital. Then a patient have any allergy for food or medication. Then current medication we can ask, and over the counter medication he is taking, vitamins, supplements, any another medication, herbal products or anything. Past medical history also is, you can ask past hospitalization, past surgery or any illness. Then last meal when he took. Then last events what lead up to the current presentation. Like that we can collect the history from family member or relatives or our health workers. In conclusion, American Heart Association following systematic approach. Each and every algorithm is systematic only. We want to be study deeply and we want to follow the protocol as per them.